Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, a podcast where we dive into the science behind this powerful medication in immunology. I'm your host, Dr. Shikha Agrawal. In today's episode on the science behind tocilizumab blocking IL-6 receptors to reduce inflammation, we are pulling back the curtain on how tocilizumab actually works inside the body. It's not just about stopping inflammation, it's about precision. Prachi Virat is here, our microbiome navigator with a passion for bioinformatics. Welcome to the show, Prachi. Let's get into the heart of the science.
It's great to join you for another episode. Thanks for warm welcome back.
In our previous episode, we discussed that IL-6 is a key player of our immune system, which kickstarts inflammation to protect our body from injury or infection. But persistent or excessive IL-6 can trigger chronic inflammation, as in the case of rheumatoid arthritis. Now, Prachi, having understood the role of IL-6, the question arises that how does tocilizumab come into play?
Tocilizumab is a monoclonal antibody, which means it's a lab-created protein designed to target something specific. Its target, the IL-6 receptor, the site on cell that IL-6 bind to in order to deliver its inflammatory message.
So, if IL-6 is the message, the receptor is the mailbox.
Exactly, tocilizumab blocks the mailbox. It binds to the IL-6 receptor and prevents IL-6 from delivering its message. Without that signal, the body produces fewer inflammatory molecules and symptoms start to improve.
So, it's like cutting off the signal before the immune system gets carried away.
That's right, it's a targeted approach that helps control inflammation without suppressing the entire immune system.
Let's talk about what this looks like in real life. How does this mechanism help patients with conditions like rheumatoid arthritis?
In rheumatoid arthritis, IL-6 play a major role in damaging joints by driving constant inflammation. Tocilizumab helps interrupt that cycle, lead to reduced joint pain, swelling, and long-term damage. Many patients feel significant relief and regain function they had lost.
And it's also used in more urgent scenarios, right?
Yes, one major example is cytokine release syndrome or CRS. This can happen after certain cancer treatment or severe infection. The immune system goes into overdrive, releasing a flood of cytokines, including IL-6. Tocilizumab can be life-saving in these diseases by calming that immune storm quickly.
So it's not just a long term treatment, it can be used to put out immune system fires in the short term too.
Exactly, it's both versatile and powerful when used in right context.
Before we wrap up, let's talk about why it's important to understand how a medication like tocilizumab works.
Yes, absolutely. Let's unpack that a little. Knowing the mechanism helps doctor match the treatment for the right condition. Tocilizumab is highly targeted. It focuses especially on the IL-6 pathway. That's great for conditions driven by IL-6, but it won't work for every kind of inflammation, and because it modifies immune responses, it's important to use it carefully.
So, understanding the science isn't just academic, it actually guides real world decisions.
Absolutely, it helps clinicians weigh benefit against risk and allows patients to make more informed choices about their care.
That's a great note to end on, Prachi. It's been wonderful having you on. Can't wait for our next episode.
My pleasure. Thanks for having me.
To our listeners, we appreciate you spending our time with us and being part of Tocilizumab Chronicles Beyond the Cytokine Storm. If you found this conversation helpful, please share it with your friends, colleagues, or